Okay, hey everyone. I just wanted to welcome everyone back. It's nice to see everyone again. We also have a new member. This is our Sex and COVID Talk Part 2. So we already did a Part 1 where we kind of talked about the practices and how people have been finding or trying to connect sexually and find sexual intimacy during this time of COVID. And so now we thought there was a lot of questions happening from a more medical standpoint. So we thought it'd be great to invite one of the physicians from the Antiviral Research Center that I work at to join us to help answer those questions. So before we get started, I think we can just all go around and introduce ourselves. I'll go first. My name is Marvin Hanashiro. My pronouns are he, him, his, and I am an employee at the UCSD Antiviral Research Center. Strawberry?
Hello, I am Strawberry Corncakes. I am a performer, activist, supermodel extraordinaire. Okay. My pronouns are everything. I go by all. And yeah, I'm here and I'm ready to talk about sex again.
Cool. Baby?
Hi, I'm Baby. I use she, her pronouns. And I'm a writer, actor, and dancer, among other things.
And then Dr. Wagner.
Hello, everyone. My name is Gabriel Wagner. I'm an infectious disease specialist. I'm an assistant professor of medicine at UC San Diego, and my topics of interest are HIV clinical medicine and HIV research, as well as sexual health. And my pronouns are he, him, his.
Great. Well, so let's kind of get into it. So I know that we had some questions come up from the last talk. So I think, Baby, you wanted to start us off, right?
Yes. So the first question we've been getting is, if I'm not having sex right now, should I still be taking PrEP? And if I stop, what will happen?
Right. So PrEP is a medication that is taken, that is typically taken on a daily basis to minimize the risk of getting HIV. And the short answer to that question is yes. Folks should still be taking the medication every day. The reason for that is because the medication is most effective when there is enough of it on board in your system, in one's person. And so that is best done when it is taken every day. And it is intended to be taken every day because one typically does not anticipate when one will be having sex next. So now folks can, the COVID pandemic, here in California, the self-isolation mandate happened in mid-March, or on March 19th, I think. So since then, of course, there was a period of time when people were not going out and not getting the chance to have sex. Now, people will have the opportunity. And the key issue here is that typically one cannot plan, oftentimes one cannot plan or anticipate when one will next be having sex.
Okay.
And so as a result, it is safest to have enough of it in your system just in case one has sex and one wants to and you want to protect yourself.
Okay. So that kind of, so you're also referencing, right, because of the fact that things have been reopening right now. I think the last time we had this talk, like bars weren't open yet. The restaurants, I think, were only still doing takeout in San Diego. And so I think you're right. So now that's more of an opportunity for, we're all kind of leaving our houses more and getting a little bit more free with our activities. Then definitely we're not back to the norm, but it sounds like that if since we're getting back to being socializing and everything like that, there's opportunity for us to have sex. And so because of that, we should probably be on PrEP, if you're taking PrEP, to maintain taking PrEP in order to make sure you're protected.
And the key, right, and the key issue is that, human behavior is just very spontaneous by nature. We're spontaneous animals. Oftentimes we cannot know when will next be having sex. So
True.
it's to account for that spontaneity, that unpredictability.
Well, so another question then, and as a follow-up to what Baby asked then is, you know, I do have some friends that were on PrEP but stopped because they were being very strict about not having sex. So they figured, like, why should I take it? So, you know, I can't remember, what is the recommendation again for once you start taking PrEP again? How long did it take for your body to have the full amount of protection?
Yeah, so once you stop taking PrEP, then it'll stay in your system for many days, actually. The PrEP is 2 medications in a fixed dose combination pill. And tenofovir actually stays in your body for many, many days. So like around 5 days afterwards, it'll still be in there, but it'll die out. It'll die out usually around 5 or 7 days. And likewise, once you stop and then you restart taking the medication, approximately 7 days until again the medication reaches protective levels in your body.
Okay.
So hence that lag period of time.
Okay. So then as a follow-up to that, I know that we were talking about this kind of just a little bit, but I've heard about sometimes people using PrEP, quote unquote, on demand, or on demand meaning when they're about to have a planned sexual encounter and not necessarily on a daily basis. Is that something that is FDA approved, or that's something that's recommended at this point, or should it really just be taking it daily?
So yes, on-demand PrEP is something that exists. It's also known as 2-1-1 PrEP because the 2 doses are taken 2 to 24 hours before sex, and then once daily for the 2 days after. And this strategy actually already has some data behind it, and it is used in Europe. By European guidelines, it's recommended. This strategy is not yet FDA approved in the US, and it is not recommended by CDC guidelines, at least not yet. That being said, an article just came out in one of our journals in the last couple of weeks that demonstrated data. This is based out of experience of a large healthcare system in San Francisco, Kaiser. And as a result, already several institutions and already individual providers are using this strategy. So already there are some people that are using this strategy. So again, it's not recommended by the major health authority guidelines in the US. But if this is something that you might be interested in, then I'd recommend talking to your PrEP provider about this.
Cool.
And I should say that the data behind it looks good. It looks like it's just as effective as taking PrEP every day. This is looking at men, though. You know, in what in the literature is called men who have sex with men.
Okay.
Yeah, it appears to be pretty good when compared to standard dosing. Now, there can be a little bit of, you know, sometimes it's hard for people to determine themselves, you know, how often exactly am I having sex, you know. Some people just, in fact, in the study, some people just decided that this kind of strategy was too hard, and so they just went back to just simple once a day. Make it once a day.
Mm-hmm.
So what?
Yes.
Sorry, if somebody's using that method, like taking the 2 and then the 1, wouldn't that kind of affect like their organs that, you know, they warn us about while taking PrEP?
That's a good question.
Like our liver.
Right, that's a good question. So we would expect that it would impact it less because you have less exposure to the medications. But we need more data around that. That strategy has not been looked at in as much detail as once daily dosing. but we would expect that it would have less effect because, of course, you're not subjecting yourself to the medication every single day.
Yeah.
But yeah, people do in the study. It was interesting that some people did go back and forth between strategies because it's whatever fits your lifestyle. And if you think that you're having sex more frequently, then you would do daily. And if you think that you're having sex less frequently, then you might do the on-demand strategy, the 2-1-1 strategy.
Okay.
Well, Strawberry, I know that you had a question about, like sex and COVID, right?
Yeah. So, Dr. Wagner, if I'm having sex, what are some tips to avoid getting COVID? Like, should I wear a mask? Like, should I avoid facial contact? Like, how can I still have sex while this pandemic is happening?
Yeah, so that's a great question. And so I guess first and foremost, approach it from the vantage point of being proactive about your sexual health. These are very important questions to ask. And it's okay to want to have sex, and it's okay to ask these questions to find out the best way and the safest way to go about it now that we are all living in the time of COVID. So I guess the overarching concept has to do with the fact that the novel coronavirus is a highly transmissible virus. It is a respiratory virus, so primarily transmitted through droplets, cough, or fluids that come from the saliva that comes from the mouth, or nasal secretions. Like, for example, someone coughing on you, or someone who has the disease coughing on you, or talking in your face. So sex, to our knowledge, does not appear to be one of the main ways that it is transmitted. We don't have lots of data around this topic. More is coming out, but it appears that sex is not the main way that it is transmitted. So it appears that we worry less about that. The main way, again, is respiratory, someone coughing on you or someone speaking really close to you. So that being said, in order of tiers, the safest person to have sex with is yourself. So masturbation, and then other things to consider are long distance sexting or sex toys and things like that can be controlled long distance. If you the next level of risk is to have someone have sex with someone in your household. Now this is in the guidelines. I find it interesting because oftentimes you don't have to be living with someone that you can readily have sex with. So but the idea there is that it's the household, right? The household is what is safest, because you're all living together, and assuming that all household members are taking the proper universal masking and social distancing precautions. The next level would be to find someone outside of the household, and there it's recommended that you find someone you can trust. Now that's a very general recommendation, but basically what it's getting at is someone that you think also is being as safe as possible, that is taking the social distancing, the masking precautions, that staying away from large gatherings as closely as possible. This is someone that well, someone that they can tell. For example, if this is someone that well, and they tell you honestly that they just participated in one of the Black Lives Matters protests last week or something like that, then you might think to yourself, well, thank you for telling me that. That may be a little bit risky then for us to hook up today. So the single person outside of the household would be the next level of risk. The next level, I guess the riskiest would be to have sex with multiple people, multiple unknown people, or multiple people that you do not know or that you do not trust.
Yeah, that's how I feel because, like, for instance, I deleted Grindr for a little bit, and I then just got it back again a couple days ago, and it's like, people. I'm like, what are you looking for? Like the typical hookup app, vocabulary and conversation is like, oh, what are you looking for, this and that, and then I asked oh, well, when was the last time you were tested? And they'll be like, oh, January. I'm like, okay, well, when was the last time you had sex? Oh, 2 weeks ago.
Right.
Yeah. Sorry, can't trust that. Bye bye. So I can literally, I downloaded Grindr, woke up 5 o'clock in the morning to use the restroom. I had 20 messages, and literally not one of those people were even trustworthy. Yeah, I'm like, you guys people aren't taking their precautions.
And I'm glad you mentioned that, Strawberry, just because, one of the things that is recommended also now be a part of the discussions, right? We normally, in this day and age, are very easily ask about, when was the last time you got tested? Are you on PrEP? Now that question should include questions about COVID risk. When was the last time you were in a crowd? Have you been tested for COVID? What is your situation like? They should be part of these questions now, in addition to when was the last time you were tested for HIV.
I mean, it kind of goes back to a little bit, we touched upon this during our first talk, but, I think it sounds like a lot of it is like we always do when it comes to having sex in general. It's just trying to help mitigate risk of getting any type of infection, right? So trying not to get chlamydia or gonorrhea, but now we have to include COVID on top of that.
Yeah.
It sounds like, with Strawberry, people are thirsty right now.
And so am I.
Yeah. Yeah. But because of that, I didn't think about that before is, people are having sex, but they haven't been tested since before COVID. That's something we really need to be, all of us need to be careful, right? Once we're getting back out there, Yeah.
And it's so I'm on my hormone therapy, so every 3 months I have to go get, the checkup and everything and blah, blah, blah. And it's the last time they asked if I could just do it from home. So it's I normally get tested for everything while I'm on my checkup, but since I just did over the phone checkup, I wasn't able to be tested.
Right.
So it's but at the same time, I haven't had sex since the last time I was tested. So I do still know my status, but it's it's obviously still good to know know your status, and I'm sure people are probably thinking the same thing, oh well, the clinics aren't taking everybody, so but there's ways around it.
Yeah. Baby, were you gonna say something?
Yeah, I wanted to ask if with reopenings, if any place in San Diego has started testing for STDs again, because that's kind of a hard ask with a lot of the places that where I was getting STD testing in San Diego. They tested me in April because I was already a patient there, but I'm sure if they had any new patients, they wouldn't be able to test them either. So I feel lucky that I can say I've been tested in April. But I feel I don't know, that's hard to ask people when was the last time you were tested if STD testing is not something that's possible right now.
So, and maybe Marvin knows as much as me about this, but at this point, healthcare facilities are opening. And at this point, yes, I believe that there should be more testing opportunities. Yeah. I don't know how widely available they are as, pre-COVID, but and specifically, I don't know about county public health. Do you know, Marvin?
Yeah, no, so I know the county health department is doing testing by full STI testing by appointment only. So you can still get it through them. I have private health insurance. And so prior, about like in March, April, they weren't seeing anyone. But now I recently went in for my PrEP follow-up and I was able to get STI testing because I requested it. Because now, like as Dr. Wagner said, the healthcare systems are finally opening up more. So I think that's a good thing for all of us, right? So it's like, yeah, there was a short period of time where things were shut down, no one was able to get tested, but now things are opening. And the county health department for sure, I know is doing by appointment only. So it's like people, we got to tell all our friends and stuff and potential hookups, like you can go get tested.
Yeah. So Dr. Wagner, another quick question. So another thing with like the whole hookup culture or even just talking to people in general, it's like, I've been telling them like, oh, sorry, I'm not, being sexually active during the pandemic. But like, okay, well, what about when it's over? And I'm like, yeah, when it's over. But then it's like, when is this over? Quote unquote, like, oh, it's gonna be over. Like, obviously, it's not gonna go anywhere, like flat out blank. But when this is over or when it starts to decrease, how long should we wait until we like start to, kind of bring down our walls to like start having sex again, like before the pandemic?
Yeah, so the reopening really was the reopening of the country and businesses was necessary for the economy, but it has not changed anything about infectious risk. The virus, unfortunately, is still out there, and this reopening does not change any of that. And in fact, as I speak, there are record number cases of COVID in San Diego County and in California, and over 2 million cases in the US, and the numbers are growing fast. So it's great that we're talking about all these strategies to lessen the risk of getting HIV while we're having sex, but I do not know when we will be able to change that. In fact, this may be a little difficult to hear, but I don't anticipate that we will be able to fully go back to pre-COVID sex anytime soon, really until we have protection from infection. And that won't be until we have we have immunity either from natural infection or from a vaccine.
Is there any like news about a vaccine at all that you could tell us? I mean, I know you're not the governor giving out, his daily, weekly things, but do you know anything about a vaccine for us commoners?
Yeah, so fortunately, and the one thing I will say is, and this is very, very positive, actually, very optimistic, is the fact that just the science community has been moving very fast, faster than I've seen it, because so many people are now turning their work and their focus on a single problem, and so oh, am I cutting out?
Oh, we can hear you.
Okay. Yeah, right now I think there's 10 vaccine candidates that are in clinical trials or so, something like that. At least last time I checked, that may be more now. And I think 3 are already poised, have already started clinical trials, or will soon start clinical trials. And they all looked very good in preclinical trials, so meaning on animals and in the lab, and so that's great. Of course, it's a different story once you test them in humans. Oftentimes, there can be unpredictable things that happen, but that is great. And the other positive thing about this is that there's like around 10 or so vaccine candidates that are being deployed, will soon be deployed in clinical trials, but there's like hundreds of vaccine candidates that are being tested even in the lab, so if something will not work already, there's a group of scientists that will be coming out with the next thing that could be tested for this. So, and I think these vaccine trials will move very quickly. So I think that is good. So we'll see.
Okay.
Thank you.
So it sounds like we're going to have to be wearing masks for a really long time, right? In public.
Yeah. Wearing masks and building glory holes.
Well, that's something, right? We kind of didn't touch upon too deeply, but there was like the New York City Health Department came out with a set of guidelines, and some of them were like at a basic level. So if you were to have sex, not saying that we're recommending that, but if you are, you can wear a mask during sex, right? Or put a barrier between you and your partner.
Yeah, and the principle again goes back to the fact that this is a respiratory virus predominantly, and so when you're intimate, kissing, for example, actually, ironically, has now become one of the riskiest activities you can do during sex, because there you're actually exchanging saliva, whereas oral sex, it's actually not as risky. So yeah, so and you from there you can take that principle and how you can play around with different body movements or different positions, you know, glory holes, oral sex, you know, trying to keep head away from head, your head away from
not face to face, right?
right. Yeah, don't want that.
Yeah.
So now all these anon lovers could have their moment.
Right.
Does anyone else have any questions?
No, I'm questioned out. I actually got a lot of questions answered, so I'm walking away from this very in good spirits, I would say.
Awesome. Well, okay. Well, then I just wanted to say, you know, thank you everyone for tuning in and coming in, and especially Dr. Wagner for answering the questions and giving us a lot to think about.
Thank you for allowing me to participate. This has been great. I'm thrilled to be here with you guys.
Awesome. Okay. Well, I guess we won't do anything else. So thank you, everyone. Hopefully we'll see everyone again soon.
Yes. And remember, wrap it up before you smack it up.
That's perfect. I love it. All right.
Bye.
Bye.